everybody, and welcome to the first qiCommunity webinar for 2018. Improvement Foundation hopes to bring you some great topics this year and are really looking forward to the year ahead. You may not know that we offer other services, so I would encourage you to visit improve.org.au and to check us out. Today we have Brooke Walsh presenting to us on continence. Brooke is a registered nurse who has specialised in continence for the last 10 years within communities and hospitals in Western Australia. She is passionate about helping people of all ages regain, maintain and manage their continence issues. We also have Dr. Tony Lemke, who is the chair of qiCommunity and of course is also a very busy GP at the Alstonville practice in North Coast, New South Wales. So welcome Brooke and Tony, and thank you for being here today.
Yeah, thank you very much, Sarah, and welcome everybody who's joined us on the qiCommunity webinar. We'll be able to ask questions in the chat panel as we go along, and please feel free to pop your questions in the chat. As Sarah said, my name's Tony Lemke. I'm a GP in Alstonville in northern New South Wales, where there is about to be a huge thunderstorm, I suspect, and a very warm welcome to Brooke Walsh, who's at the Joondalup Health Service in Western Australia. Good morning, Brooke. What's the weather like over west?
Good morning. It is beautiful and sunny over west as usual.
As always. We'll send you over some of the rain.
Yeah, I think we're heading into the high 30s.
So Brooke, I'll keep an eye out for the questions and interrupt you when there are some appropriate ones, or we'll come to them at the end. But Brooke, the topic today we're talking about, which is incontinence. I know that all of us who work in general practice, we know it's a big problem, but it's probably even bigger than we suspect. Is that right?
Indeed. So if you go by the Continence Foundation of Australia, their statistics, they're suggesting that 4.8 million Australians over the age are incontinent. So we're not capturing also the younger children with disabilities that we know are going to be living a long life of continence management. Part of the problem with that is obviously, as seen on the slide, 65% of women and 30% of men in a GP waiting room reported urinary incontinence. 31% of those report having sought help. So only a third of those are seeing a need either to seek help, or in a lot of cases, in my experience, is to know that there is actually help available. So there has been some huge Commonwealth studies, and they are quite recent. So what they're noticing as well is that it's not only a problem in the community. What's happening is for those that are in the community that are on the verge of going into residential care, especially with fecal incontinence, we tend to find that so the families are managing with mum or dad at home or just assisting them in their home, but once they get to the point of not being able to manage the continence on their own, that seems to be the breaking factor that tends to put people into their residential care. With the ACATs, obviously, you guys would be across that board, but what they are finding when the social workers and the ACAT nurses are going into the homes and meeting with the people, what they're finding is that continence, once they're actually being asked about it, it's an issue and it's just not being managed. We obviously, we have great focus on end-of-life care pathways going through at the moment, and they are fantastic. Same with dementia care. It's starting to get a lot of traction, which is brilliant. But what we're finding is that people know so much about their, obviously for people with older parents, they know a lot about their history, but ask them about the continence and we get silence. So what we're finding is that people are having open conversations about everything other than poo and wee, basically. And so what happens is people manage the best they can, and what we see is people using inappropriate products. We're seeing skin breakdown, we're seeing social isolation. It starts to become a bit of a snowball effect, and it starts to become extremely difficult for the people to manage where it shouldn't be. It should be basic management and better support. Okay, I've added this slide in. It's a bit of a cheeky slide. And it's a book, and it had been suggested that initially it had been written by someone as a legitimate thing, and has since come out that it's not. But I still love this little part of the book, and it talks about my dribbling keeps getting worse, while my underpants are excellent for highlighting yellow stains. And basically he goes on and he keeps talking about the fact that he's living in a nursing home and he pre-washes his underwear because how embarrassing would it be to find out that he's actually having these yellow stains on his underwear? So even in a facility area where it just highlights beautifully that even in a facility with older people, and obviously he wouldn't be the only one that would be incontinent if that was the real situation, he still sees the need to hide this fact, and this is the problem. And if we go to the next, sorry, Sarah, next slide. Yeah, so this is the problem. It's just a laugh. It's a constant source of jokes. So, you know, happy birthday, you're 1 year closer to being, and this is part of the problem. We talk about incontinence as it's a normal part of aging, and it shouldn't be accepted as a normal part of aging, and that's the Continence Advisor mantra. So as we get older, obviously it becomes an increased risk of incontinence, but it shouldn't be accepted that as we get older we become incontinent. The other part is that obviously it is linked to a lot of humour. So I've put in there Mrs. Emery from Little Britain, who basically the whole skit is that she wheezes and she just continues on with normal life, and we're supposed to find that really amusing. And to be honest, I saw that in a forum full of continence advisors and still half of them laugh. So it's concerning that if the professionals are finding this amusing, what's going on in the community.
So Brooke, if 2/3 of my patients with incontinence don't tell me or anyone else about it, it's going to be hard to manage, isn't it? Why do you? What are some of your thinking about why people just won't talk about it? We talk about everything except poo and wee. You reckon?
Yeah, that's right. So look, obviously there's a lot of shame, there's a lot of stigma. It starts to become really complex. So you wouldn't believe between different cultures how different things are viewed. So if we've got anyone from remote communities, in the Indigenous communities, there's a lot of shame around incontinence and a lot of social isolation. Obviously, if you've got a male GP with certain cultures, and they just wouldn't even dream of talking about continence issues. Like I said before, it's accepted as normal, and that's really concerning. So if I think that the fact that I'm wetting myself is normal, why would I bother to speak to my GP about it? So it's really giving the people the tools to know that this isn't acceptable. No, you shouldn't be incontinent, and yes, there is help. So yeah, so it's not frequently discussed. Things can be improved. And the other thing is, you know, I go to the doctor and I see him for a 15-minute session, and I need to talk to him. He wants to talk to me about my blood pressure maybe, and I want to talk to him about the big thing that's growing on my arm. And I won't bother him with the extra stuff of, hey, my bladder or bowel function isn't really functioning as well as it should be. The other one, and this is huge, and I'm a big advocate for carers because they're amazing, but what they will do is, if someone's in a caring situation and they're dealing with their own continence problems or the continence of their loved ones, what they do is they kind of put this as what they need last. So they're so busy doing the day-to-days of showering and feeding and doing everything else that they basically just put all of the rest of it on the back burner. And they're basically just burnt out. It's generally what I find. And so by the time they come and see me, it's because someone has cleverly picked up that there's an issue going on and they've actually been directed into my care.
So, Brooke, tell us, people may have trouble, starting the conversation is important. People may have trouble even with the words that they're going to use around their wheeze and poos.
Yeah, that's right. So we talk about all sorts of things, and we love euphemisms, we love plumbing, we love talking about waterworks. If you've got someone that English is their second language, they're going to look at you with a very confused look. And I learned that one the hard way because I've done lots of conversations where I've realised that we've been on two different conversations. And what I have learned is that you just need to be really open and honest. So for someone that I'm confident that they would know what their bladder is, I would say, are you having issues with your urine leaking and that your bladder isn't working well, or that you're having problems with your bowel, or you're getting constipated? You really do need to judge the person. So have that conversation and be honest with them and say, hey, are you confident that you understand what I'm asking? And what you'll find is eventually you'll find a language that's working for both of you, but keep it professional, keep it open, avoid using slang if you can. But yeah, really, you just need to be really open and honest. And there's nothing wrong with seeing, obviously, sometimes you'll have someone that comes in and you can smell that they've been had urinary incontinence or fecal incontinence. You could just say very gently, obviously in the right setting, in an isolated area, hi, I've just noticed that I can smell something there. If you're having problems with your bladder bladder behaviour, or that are you having any urinary leakage? This is obviously when the benefit of having good relationships with your consumers, clients, patients comes in, but it is really just being honest about it. And to be honest, for a lot of people, some people might be offended, but as long as you tread carefully, most people are actually relieved that they can actually get some help. You do occasionally, on the other spectrum, have people wonder and going, my friend has pads and I want pads too. And that's another great thing. So obviously, continence pads and aids are fantastic, and we use them as a source of allowing people to get back into the community, and obviously skincare. There's so many benefits to it, but it's a really good gateway. So if someone wants to know about funding for pads, obviously something's going on, so there might be a great way to nab someone as well and just say, hey, what's going on? Can we improve the situation, as well as just looking at your continence products?
Brooke, you reminded me how difficult it can be to start these conversations, particularly when you smell something and find it hard to mention, and then people deny it, and then you're a bit stuck. I guess we shouldn't consider incontinence normal.
That's right, and this is the problem. You see, you know, an 80-year-old lady and she's incontinent, and you go, oh yeah, she's incontinent. That's what's going to happen. But you know, there are things that we can do to better it. And I always say to my patients that I see, some people, we can do some pelvic floor work and we can do some extra work, or they'll get their pessaries or whatever it is, and the problem resolves, and that's fantastic. Most people, if we can't cure it as such, we can actually improve it. And if we can't improve it, we can manage it. And so it's really empowering the person with the continence issues to know that, hey, I've actually got control of this, because otherwise it's an out of control situation. And that then, like I said, leads to your social isolations, and it leads to change of quality of life. It just impacts people in so many ways, and even just people who are related to the people that have got continence issues. Oh, you know, mum won't come out with me, we don't see her anymore, she won't come out and see the kids' sport anymore. You know, it in fact impacts the whole family, but ironically we just keep avoiding the question. So sometimes, yeah, the conversation is difficult, but it's one worth having.
Yeah, that's a good tip. So incontinence isn't normal, but it's common. If it's there, it can be improved, and if it can't be improved, it can always be managed. There's always something that you can do.
Exactly, and that's for fecal and urinary incontinence. I mean, urinary incontinence is difficult. Fecal incontinence, for people that are living with it, obviously it becomes a lot more obvious, because obviously the fecal smell is a lot more, it's a lot stronger, and it's more recognisable, and obviously people are then walking around with dirty pants if they're out in the community and they aren't properly set up. So, you know, urinary incontinence is huge, but it's really important not to forget those that are suffering with their fecal incontinence as well. Oh, okay, thanks, Sarah. So knowing there is a problem. So this is knowing whether or not these people have issues. So obviously sometimes it's evident. So like we said, you know, you can smell it on their clothes, or you can see that their pants are a little bit wet when they come in. Like I said, they might ask about products. That tends to be a really great way to nab people. But there are other ways. So, you know, someone that comes into your practice and you know they've been recently diagnosed with Parkinson's disease or MS, or a lot of the neurological ones are your top ones, basically, to know that probably long term we're going to have continence issues. So even if you have the conversation with them then, when they might not have the issue, but just say, look, we know, say someone has Parkinson's, we know that with Parkinson's disease that bladder management becomes complex and it's difficult, and that's okay, because we're here to support you through it. So if you start to have issues arise, just let us know and we can direct you to the right people. And the joy of that is that hopefully they're feeling more confident by the time they're ready to have that conversation with you. Sometimes you'll have family seek help, and this one can be tricky. So someone might say, hey, mum is having accidents, is generally what they'll tell me, but they're having urinary incontinence. She'll deny it. Can you go speak to her? And so this is when you have to get a bit playful with the language, and you need to say, you know, I always introduce myself to whoever I'm speaking to, and I'll say, I've heard that your bladder behaviour is your bladder's behaving a bit tricky at the moment. Are you needing to use pads? Because it's funny how sometimes people will tell you they're using pads, and because the pads are capturing the continence, they don't. It's a bit like your patients with blood pressure problems. They're taking that blood pressure, the antihypertensive. They don't have blood pressure problems anymore. Well, they do. We're just managing it. So the same, they're just managing it in their own way, but can we improve it and manage it better? And look, for me, I talk about who and we all day. Bladder and bowel function is what I do, so I probably have become a little bit adapted to the fact that, you know, it's a discussion I have to have. For everybody else, it's probably something that you don't have to do often, but if you start including it in your general discussion, so if you're reviewing a person and you're taking a bit of a history, there's nothing wrong with saying, you know, okay, how's your blood pressure? How's this going? Are you showering and dressing yourself? Okay, are you needing to use anything for your bowels? Is always a good one, because people are okay generally about constipation. Oh, yeah, yeah. Okay, and how's your bladder behaving as well? So it's including it in all of those reviews that you're doing. And the other thing that's really useful is just having information. So if you're in a practice and you've got some information on urinary incontinence, or the Continence Foundation helpline, which is national, so everybody can use it. If you've just got it there and they're not confident to speak to you, maybe they're willing to take the flyer and speak to somebody over the phone.
I think that's really helpful, Brooke. It's so common that we really should be asking about it routinely in particular phases of people's age and illness. And one of the problems perhaps is that we're scared of the answer, because then we'll have to deal with it. So having help available readily would make it easier for us to ask the question.
Yeah, so what I would say is the joy of finding out the answer is that you can handle the situation to us. So the continents of obviously remote areas are a little bit trickier. There is a Continence Helpline though, so they have got contact details of people within the community. So one, they can give you a bit of generalised information over the phone. Two, they can also direct you to where you can get assistance. There are continence advisors in most of the public hospitals across Australia. They don't have to even go on the care plan. They can just call up, and generally my understanding is most of the hospitals will just take patient review. You can actually just call up and say, I want to see the continence advisor. Some do require a GP referral. Yeah, South Australia is a tricky one. It's a bit like there's funding systems in everywhere but South Australia. Look, if worse comes to worse and you don't have that, honestly, what I would say is contact the Continence Foundation hotline, which I've put on the slide, and they will let you know where your local continence advisor is. There are continence advisors in South Australia. I've met them, they're there, but they will be able to tell you who would be the best to refer to. Yeah, so look, you've got your continence nurses. It is important though to know that continence advisors can do so much. There are times where people actually need to see urogynecologists, gynecologists and urologists. So for the really complex cases, obviously that's out of the nurse's hands, and that then goes to the GP, and they will need to be referred appropriately. So it's really important to remember that not everybody that's incontinent is old. So you've got people that are post-baby, you know, in their 20s and 30s having continence issues. You have children with continence issues. You have men post-radical prostatectomies having continence issues. So don't just assume that it's your older patients that are having issues. Obviously, if they've had radicals, they should be linked to a urologist, and they should be able to put them in touch with the right people. There are state-funded community providers. Now, unfortunately for those of you in South Australia, this gets a little bit tricky. So across most of the states, there are state-funded assistance packages, and basically you either need a healthcare card or a pension card. South Australia is its own little independent thing, and unless you are already registered with CAPS, which I'll go through later, and you have a disability, it starts to become tricky. So that's when you need to basically be able to provide them the information of where they can get their products from. And there are a few nationwide providers that have all of the continence needs that you should have, that carry all the continence products that you should need. Yeah, Continence Foundation of Australia hotline. This is a great little resource. So I'll go through their resources as well. But basically, they are linked to all of us. So there is a national board, and then there are state boards, and the state boards are run by continence advisors, urologists, gynecologists, urogynecologists. They're all kind of on board. We're in communication with each other. So if the national hotline can't help you, what they will be able to do is direct you to your state-specific continence committee, and they'll be able to help you. Obviously, general practitioner is you guys, and like I said, really, it's not that you guys need to manage the nitty-gritty of it. It's just getting you guys to recognise that initially that, hey, there is an issue going on. Continence nurse advisors, like I said, yeah, in WA we are very lucky. We are scattered across all over the place, and it does become trickier. My understanding is Victoria is pretty well staffed, Queensland is terribly staffed, so it does become a little bit trickier depending on which state you are in. But look, we will definitely, like I said, if you contact CFA, they should be able to definitely direct you to the right sources. So the continence resources, the CFA have multiple resources on everything from children to adults, bladder management, fecal management, pelvic floor information, prolapse information. I haven't had anything that I can't find so far. It is in multiple languages. And what that does is if you print that out, it prints out in whichever language you have chosen, and on the other side is in English, so that you should be able to go to that section and know what's being said in that section, so you can run through it with the person. There are Indigenous specific resources, and what the consumer feedback on that was in the remote areas they loved it. In the metro areas it wasn't as well received. People tended to just like the standardised. They thought that the Aboriginal ones basically were not really appropriate for them. So that's just interesting feedback from the consumer. So if you go to the resources page, you should be able to get these resources for free. So just follow, you can just click onto the link, or you can just Google, good old Google, the CFA website, and you can just click onto resources and you can just print them out from there. So you can order them and get them sent to you in the nice glossy brochures, or you can just print them out as you need. On the next side, okay, so where to get funding from? So funding support is available nationwide through CAPS. That's for people either with a neurological condition or people with a pension card and a healthcare card, or a healthcare card, sorry, should I say, and eligible criteria. So there is a list, you can just get it online and it will tell you what the eligible criteria is, and they basically put money into the bank account for people to help manage their continence aids. There's NDIS, which I'm sure everybody is getting drenched in at the moment. So obviously that's the insurance scheme. So that's they do need to see somebody that's qualified. So they do need to see someone that's registered as a continence advisor to get their insurance money back for their continence needs. DVA Gold cards are amazing things, I'm sure you guys are aware, and we can basically order things. So that can generally be done either through GPs or it can be done through continence advisors. Some OTs are able as well, and then obviously there's individualised state schemes.
Okay, so we've come to question time. We haven't had any comments in the chat pane at all. I do have everyone muted, but if you would like to ask a question, please just pop your hand up, which is a little hand icon near above your name, and we can actually unmute you if you have any questions.
Brooke, I might ask a question while we're waiting for others to come in. If I'm the practice nurse doing the care plan or a health assessment for a patient who says that they developed some incontinence, is it safe for me to start the ball rolling by talking about pelvic floor exercises and giving them some resources on pelvic floor exercise? And if so, is there a favourite resource that you like to use?
Yeah, so if I'm doing, I use the CFAs. Previous to being with Ramsay, I was with WA Health, and we had to use the CFAs, and to be honest, it's a great little tool. And it's free. So yeah, look, what I would say about pelvic floors is they don't generally do harm. They are done badly. So just be really confident that you're teaching the patient the correct way of doing pelvic floor, and just be really careful about telling them to stop their urine flow, because if they start doing that as a regular thing, what we could lead is into urinary tract infections. So I generally talk about being able to stop the flow and pulling up those muscles, but I then follow that with, please don't do that as a regular practice. Don't stop your flow regularly. The other thing I would say, just as a little hot tip, sometimes the issue is that the pelvic floor is, especially if it's a younger person, the pelvic floor is okay, but the inability for the pelvic floor to relax is actually the issue. So when we do pelvic floor exercises, we talk about lifting the pelvic floor, but they actually need to relax the pelvic floor for the same amount of time that they've lifted the pelvic floor between exercises. And that's really important to try and get that. What you have is some women's health physios that actually specialise in relaxing pelvic floors, and they will obviously do it under ultrasound, and they will do more guidance and do a bit of massage and those kind of things. So yeah, look, there's no harm in doing that. There's also no harm in giving them, you know, if it's someone and they're struggling, there's no harm in giving them information on the funding products. So that's also available online, and it's all done for national care. So it doesn't matter where you are, you can print it off, and it goes state by state of what's available for them.
What was that, Brooke?
Sorry. So if the patient, if you notice that maybe they're having issues with leakage and that kind of thing when they're coming into the practice, and you know that financially they're in a bit of strife, the funding scheme, Continence information, is available, and it's a national one. So if you print it off, it will go state by state what's available for them, and then they can figure out whether or not they're going to be eligible.
Okie doke. And some private physiotherapists also do pelvic floor training, is it?
They do. Look, I would be really careful. So physios are brilliant and they're a fantastic resource, but I would go to a women's health physio or a continence specific physio, because what you do is they are the ones that will be able to ultrasound. They would be the ones that will be able to get the information that's actually very reliable, and they can also go through voiding dynamics with the patient. They can go through different exercises to relax or to help with pelvic floor training. They have access to the equipment to improve pelvic floor training, all those kind of things. So if you are going to send them to a physio and the person's going to pay for it anyway, I would recommend either going to, if it's a female, a women's health physio, or otherwise a continence specific.
So if we're doing a lot of care plans and health assessments, either local health pathways may be able to answer who can do that, or maybe we ring around and find out who has a special interest in that topic.
Yeah, I could give you the WA number. Sorry, that's not helpful. Yeah, look, what I would say is if you call, once again, if you call the CFA, there's continence physios that are a part of that. So that probably, it really is your one-stop number. If you give them a call and say, do you have a list of the continence physios for that state, they can just contact the CFA. So for WA, I'll call them and say, do you have would there be any information on physios in WA? They can contact WA CFA and we would be able to provide those details for you.
Fantastic. Thank you.
Yes. So the whole point of CFA really is to try and make everybody's life easier, and that's for the patients and for the staff.
Lovely, Brooke. And Cheryl's just made a comment that Continence Matters at Calvary Hospital, North Adelaide, has a GP self-referral centre where patients can be seen and have investigations without cost of specialists, and she's included a number. So hopefully anyone from South Australia can access that. Oh,
thank you.
And there's a number. Thanks, Cheryl. I thought I'd just make a point as well that all these slides that you've been looking at today are actually available to you in the materials section of the chat pane. So all those numbers and websites and all that sort of thing, and Brooke's contact details will be coming up in a moment as well. If you just go to the materials section, you can actually just upload it or download it, and you can have all the slides available to you with all those details on it.
Can I just add it? Sorry, Sarah, can I just add one thing? I didn't see the slide. Maybe I dropped it off on the last one. But just
that one?
CFA Victoria, just to let you know, if you are dealing with teens. No, it's gone. Sorry. No, it's all right. It's gone. Oh, yeah, so the Victoria Continence Resource Centre. Wonderful. Sorry, I did initially have a picture of it. If you are dealing with teens with continence issues, they have got fantastic resources. So they've just rolled out a whole new project, and it is at Victoria Continence Resource Centre, but I've spoken to the girls there and they're happy for us to obviously access their information as need be, and they are a brilliant resource, so you can always give them a call as well. But yeah, just because they did feel like the teen area, so we do great with women that have just had babies who did great with kids in primary school, but they felt like the teen age group had been missed. So they've now developed a whole heap of new resources as well for that specific age group.
Fantastic. Thank you, Brooke, for sharing all those resources with us. We'll certainly remember to keep incontinence front in mind, and you've reminded us about removing the stigma of that conversation and how important it is for people to know that it can either be improved or managed. I think that's a great message. Sarah, that's the time we have allocated for this webinar. We'll be back next month with our next webinar, and I'll hand back to you. Thank you, Brooke.
Thank you.
Yeah, thanks, Brooke and Tony, for sharing your insights and knowledge. And I hope that everybody has got a lot out of it today. I know I certainly have. We're still scheduling next month's speaker, so please look out for the newsletter to register as per normal. I will also send out a link to everybody who registered today once our editing guru plays around with the video, and we'll have a nice clean video to be able to send to you, and also you can then share to other people. So there will be an evaluation at the end of this in the spirit of quality improvement. So please fill it out, give us your feedback. We're always interested in your thoughts. And again, I'd like to thank Brooke and Tony for your time today.